The city of Sioux City has received a $5 million grant to take care of lead in homes around Sioux City. KTIV's Connor Trett joins us in studio tonight with more on what that money could pay for. Connor?
Thanks, Matt. This program that the city has been a part of for more than a decade has been working to reduce lead poisoning cases. And tonight we take a closer look at the potential causes of lead poisoning and the ways that the city is working to prevent more cases. For years, the city of Sioux City has worked to mitigate the potential for lead poisoning by removing lead and other health hazards from homes. Lead-based paint is a large cause of lead poisoning and was banned back in 1978.
Anything pre-78, that's when they stopped taking the amount of lead out of the paint. So most of our housing stock in Sioux City, as you know, is pre-78. So you've got to get that stuff out of these houses.
There's lots of ways that this happens, but primarily lead-based paint, and Iowa is notorious for a lot of lead-based paint in homes.
A small amount of lead in someone's system has the potential to cause health problems, especially for young children.
Lead-based paints, which can be in toys, it can be on walls, on doors. Sometimes kids will just, eat, paint chips that are there, and that's what can cause those elevated levels.
They put their hands in their mouths a lot, and even some toys and things like that can be contaminated. So, kids under 5 years old, lead can have a real detrimental effect on health, on development.
The city of Sioux City received a $5 million lead hazard reduction grant from the U.S. Department of Housing and Urban Development. This will help homeowners make improvements to their homes with new windows, doors, and paint that's lead-free.
It doesn't make sense if you've got kids with high levels of lead that you're not doing everything you can, especially if it's government money, to get it out of these houses.
And as a part of the city's lead hazard reduction program, Siouxland District Health is offering blood lead tests for people taking part.
It's a small finger stick, we collect a little bit of blood, and usually we are able to get results within a few days.
And if traces of lead are found, fortunately, the treatment is relatively easy.
So Connor, the question tonight is, how can doctors treat a child with high levels of lead in their bodies?
Well, the treatment is based on an oral medication, and it actually binds the lead in the child's system, which then allows it to then get flushed out by their system.
Okay, one more thing, how often should those kids get screened?
Well, from my conversation with Dr. Enns, he says that because high lead levels don't typically have obvious symptoms, kids should be screened for lead as early as a year old and potentially up to the age of 5.
Connor?